Good morning. A very august gathering here. I see my teachers, mentors, fellow colleagues across the healthcare ecosystem, as Imroz mentioned. Many friends as well, many delegates. It's a great pleasure to see all of you and to welcome you to this Manthan 2026. If you don't mind, what's the control? I have met most of you already, and many of them, some of them today. But for those with whom I have not had a benefit of interacting before, my name is Vinod Mattoo. I'm an endocrinologist by training and have been working in the industry for the last 30 years or so, starting first with Wokhart and then with Lilly. Lilly the most time, about 14, 15 years. Bristol Myers Squibb, Sanofi, Amgen. And the last 3 years or so, I am in my current position of Executive Director at Diagnosearch Life Sciences. As is traditional with these meetings, this is time to invoke wisdom, blessings, learning, and prosperity as well. So I would like to invite on the stage 4 distinguished people that have played such a big role in the whole pharmaceutical industry in the last 25, 30 years at least. And representing one end of the industry from the OPPI side, Mr. KG, we call him KG Sir. Very few people I call Sir. KG Sir is obviously one of them. KG Anantakrishnan. We also have Mr. Sudarshan Jain, another person I very proudly and humbly call Sir. I also want to, the other 2 distinguished members for the lighting ceremony would be Dr. Sanjay Singh and Dr. Habil Khurakiwala. A half-a-minute word about both of them. Dr. Sanjay Singh, obviously, I had some indirect interaction during their early COVID studies on the mRNA vaccine, which was the first mRNA vaccine actually tested and approved in India, but it did not get commercialized for various reasons, and maybe we'll understand why. And Dr. Habil Khurakiwala, very special, it's a very personal moment for me as well. Wokhart was my first company, and Dr. Habil Khurakiwala provided the milieu, the environment, the framework in which I could explore and prosper. And again, he's a very good example of what leadership is all about in terms of focus. I mean, Wokhart has gone through several ups and downs, and many downs in the last few years, and many assets had to be given up, but keeping his focus tight on the piece that mattered, innovation, antibiotic research that not many people are interested in, but keeping that funded and providing mentorship to that program, and we see some nice results. Very good example of what is possible. And with that, can I request our guests to come up the stage for the lamp lighting, the four of you. Mr. KG Anantakrishnan, Mr. Sudarshan Jain, Dr. Habil Khurakiwala, and Dr. Sanjay Singh, please. Thank you very much. And we'll get into the main meeting shortly, but I wanted to provide a little bit of a few minutes of context about what Manthan is, how it came about. And Manthan has been about 1 year in making, and most of the work was done by a steering committee, which is a cross industry steering committee, having mostly R&D people, but also we had some commercial presence as well, and I'll introduce the steering committee in a moment. But they started with we getting support from foundation we call the VASUs Foundation. If I can, this is in memory of an industry colleague and a friend, Dr. Vasudev Ginde. He and I were actually colleagues, initially at Wokhart and then at Lilly. And he and I were involved in the first GCP studies in India. And the year was 1993. And we and Pfizer were the first companies to start the GCP studies about, 22 years now. At that time, there were 2 ethics committees in the country. And together with Pfizer and Lilly, and also later on Quintiles, we ran several hundreds of programs actually for ethics committees, for regulators, and we helped create the SOPs or the infrastructure, intellectual infrastructure required for conducting trials in the country. He was a big part of that, and then he started his own central laboratory and created a company, a clinical research company, DiagnoSearch. Over a period of time, DiagnoSearch grew, and he was very proud always to say that we are the first and the largest homegrown CRO in India. At the moment, it's a fairly large company with a large global footprint, and unfortunately, about 3 years back, he passed away rather suddenly, and the family decided to, and based on his wishes, create a foundation that would support education and research, primarily research. And I'll come back to Manthan, what are the goals, and possibly research and education, both of them, but primarily supporting research efforts of young scientists and researchers who have good ideas but do not have execution capability to have their research ideas translate into tangible outputs and to support that kind of research. That was the reason that he had always in mind to create something like that. So in his name then, we call this foundation VASUs Foundation. I think it's a very apt name. We started late because at that time, and even now, the paperwork around registering the foundation and other things is not there, but it was based on some input from industry colleagues and steering committee that we decided to go ahead even before the full formalities were done. Again, as I said, the vision was, the whole Manthan program, and Manthan name, as you probably know, it means churning. It's based on a Sanskrit churning, and the vision was to advance conduct of original research and innovation, and the mission is basically how to get it done is basically create an environment where there is nurturing of collaboration, of new ideas, of creating platforms where we can exchange ideas. The theme for this year's meeting that was decided by the steering committee, and I'll come to the steering committee in just a moment, was India in the changing landscape of life sciences research and development. I say this specifically, the theme for this year. Manthan is envisaged to be a long-term program. Obviously, you cannot begin to see any changes in a couple of years, so this is meant to be a durable, long-term, if not an annual, more than an annual, but at least an annual meeting, but there will be more than an annual meeting, a platform. But the theme for 26 was changing landscape of life sciences research and development. And the intent was to bring together different, and sometimes competing ideation around this research, how it is done. For example, there is sometimes a natural conflict between innovative multinational companies versus, homegrown local companies. There has been for a long time, even though that pendulum is now becoming a little bit more balanced. But there is some natural, and obviously from healthcare, from policymakers, from regulatory kind of requirements and regulation, harmonization, a lot of conflicting things that are happening. And the other thing over and above all this is many companies are actually not very willing to be open about what they have done and what are the challenges they have faced, why, if they failed, why they failed. And much of this is considered proprietary, sacred and information, even though some of this is available on, clinical research sites, etc. But people are reluctant to talk about it. So we're hoping that with this forum, which is kind of I call it a multi-partisan forum, that we'll have less of those inefficiencies in sharing. And maybe this then not forms only a platform, but out of this we will have several publications, position papers, pressure groups, and maybe we form formal and informal communities out of this month, and that will take the idea and translate some of that into tangible next steps. What do we do between now and 2027? Now, after discussing all this, the last thing we want this to be another nice meeting. It was good, I heard him, I met this person, but we want to convert this into a tangible. It is not, to my mind, it's not a symposium or a meeting. It is a working group to my mind. It's a working forum. The main objectives then, to spotlight R&D excellence across the pharmaceutical and biotech sectors. And we'll start today's main sessions with very good examples at Genova and WCAT, for example, to create a forum for thought leadership and knowledge exchange on emerging R&D paradigms, to showcase India's growing role in global clinical and translational research for many years now. I've been in industry long enough. We still continue to talk about the same things. The more things change, the more they remain the same. But a part of that, there is not a lack of awareness. You talk to people one-to-one, and everyone's aware of what needs to be done. However, there seems to be a little bit of inertia when we come to implementation. And to facilitate this cross-industry collaboration, something we really are interested in, I hope that we are able to, and some of the participants in today's meeting is a reflection of that hope, because there's some academia here, some regulatory scientists, and even commercial. So there's a lot of people that this cross-functional exchange of ideas. And basically the end point is, how do we make India as competitive as it could potentially be? Not where is it today, but how can we accelerate some of the upward journey that India is facing, okay? So this is the broad objectives of Manthan. Any subsequent programs, activity we do around this will be around these objectives. The pillars, collaboration, ideas, excellence, they are very good, but without impact, they don't mean a lot. And therefore, in today's sessions, they have been thoughtfully curated. You will see several elements of these 4 pillars in many of the talks. They're based on these 4 pillars. I'm having a little bit of a problem with Now the steering committee, and I'm very grateful. I cannot tell you how grateful I am what the support we got from our industry colleagues, okay? Even though I was appointed as a convener of this, I couldn't have obviously done it. I mean, neither I have the knowledge nor the ability to put something like this together. I was supported very ably by a group of industry colleagues, and I want to introduce them one by one very quickly. My apologies, but this will be a very short introduction. Suneela, of course, she is an industry veteran, and Suneela agreed to be the chairperson of the committee, and Anirban Roy Chaudhary, who is working at Sun, associate VP, and has a lot of experience in clinical research, agreed very quickly to assume the role of an associate vice president. Anirban is the only kind of a steering committee member who is not here today. But he messaged me in the morning that his heart is here in this room. And we promised to send him a video in the next couple of days. So the group has worked very hard. In the last 6 months, there have been umpteen number of, we have actually 6 meetings, which were large meetings. But almost every day we have been working tirelessly. It's incredible how committed this whole group was to a cause which, they also had their own normal work at the same time, and they put this together in a very fantastic manner. Though the group, we call them as chairperson and co-chairperson, the steering committee was really seamless, and very glad to let the names of other people. But before I go there, Suneela, of course, everyone knows, but for those you don't know, She probably even, I'm afraid to say, preceded me in what she has in clinical, a lot of experience. I sometimes pride myself on the fact that I have a lifetime achievement award in ISCR. She's sitting in right front of me. And anytime I have a problem about what is happening, I need some advice. So Suneela is always there. She's incredible how involved she is. She's always volunteering to be part of any work group. And just any delegation that has to go to talk to the government, she's a normal automatic choice. So thank you very much, Suneela. And Anirban is not here. I will, not because he's not here, but I will kind of just say that he is the maverick in the group. And in the whole committee, he and the other member, Pavan, are the two who always have had an alternative opinion in their view, and they really hold their view as well. But thank you very much, Anirban. Thanks, Suneela. The other members of the steering committee are, can I go to the next slide, please? Oh, God. Yeah. Sorry. And if you don't mind, Suneela, just standing up and just turning around and just. The other one is Chirag Trivedi. And Chirag, if you don't mind getting up. Chirag, again, is a long-term clinical research professional at Sanofi. He spent a lot of time in clinical research, and currently he's a global clinical early operational strategy head for Sanofi. Manisha is my friend and partner, both at VASUs Foundation. Manisha, where can I see you? Okay. Friend and partner both at VASUs Foundation. She represents the family. She is the wife of late Vasudev Ginde, and also my colleague and friend at DiagnoSearch. Dr. Pavan Singh, I just mentioned, the other maverick. Dr. Pavan is the VP and head of clinical development at Kasha Biosciences. He, like me, he is an alumnus of PGI Chandigarh, and he kept us all going. Sanish, of course, everyone knows. Sanish brings a lot of expertise, and in fact, in his role at ISCR, both him and Anirban and Suneela to a large extent, they practically ran the Indian Society of Clinical Research for many, many years and gave it a direction and energy, and that is so good to see. So Sanish, many thanks. Santosh Jha is probably the third maverick, actually. After spending many years in the regional role at Singapore, I think with Takeda and some other companies, he's found his own consultants. He's moved back to India at his hometown, Ahmedabad. And in the last 1 year or so, he is kind of beginning to do several initiatives. And he provided the initial impetus of starting this even before the registration of the VASUs Foundation was complete. So thank you very much, Santosh. Saumil is a non-medical R&D. Saumil, he is president, commercial and operations at Genova, but he was my colleague at Lilly, and I've seen him grow from, what can I say, from ugly stage of, maybe a sales representative to a marketing person, and then heading divisions, and now president in commercial. He was also for many years at Roche and also at Novartis, where he headed their genetic therapy division, or gene therapy division, before he moved to Genoa. And last but not the least, and the most grounded person in the group, Dr. Seema Pai, Senior Director for India and Southeast Asia Cluster and it is their effort and their own contacts that, we did a lot of brainstorming. What you will see today is to a large extent a brainchild of their efforts. Their long hours, sweat, blood, and tears, quite honestly, if I can say it in simple terms. So a round of applause for all of them. And with that, we just briefly talked about Anirban and Suneela, and with that now, I will hand over the business end of the meeting to our chairperson, Suneela Thatte, and she'll conduct the meetings. Suneela.
Very good morning to this august audience here, and really pleasure to see what can I say, the movers and shakers of the industry here, and we hope that with your presence, whatever we as steering committee have curated so far, we'll get the real meaning, the real drive, and we will get into some actionable impact by the end of the day. But thank you so much, Dr. Mattoo, for setting the context for Manthan and for the day so well. And indeed, I mean, if you look at the global scenario for life sciences and healthcare innovation today, it is governed by deep science. The science is advancing by the minute and the hour, not by the day anymore, and technological advances. I mean, today we cannot think of innovation without technology. We are at interesting crossroads where the complexities of science are meeting the newer possibilities that technology is unlocking. Research is happening today in the lab, but it's also happening in silico. And we are seeing how artificial intelligence and machine learning are delivering on some of their early promises. So I don't think there could have been a more interesting time frame than what we currently are today, than to be on the global research and innovation scenario. And when we look at India and the scientific pool that India has to offer, I'm so proud to say this, but the scientific pool that we have is probably equal to or more than population of certain countries in the world. And nobody can match the talent bandwidth that we bring to the table, especially when it comes to science and life sciences and healthcare. But if we have to make a mark, if we have to be a significant player as a country in the global healthcare innovation scenario, we have to go beyond the talent. We have to think beyond the talent and see how we start influencing the ecosystem and make sure that that ecosystem back home here has all the elements necessary to promote innovation, where alliances among key stakeholders such as academia, industry, policymakers help co-creating a vision that strengthens India's role in global research and innovation. And with this thought in mind, the steering committee for Manthan has deliberated and curated this agenda that you see on the screen. And don't worry, I'm not going to read it line by line, but just give you an overview of that. So we have 4 power-packed sessions for you, as you can see here. The first session will focus on building on our strengths. I mean, today when we look at pharmaceutical industry in India and its global impact, we are undoubtedly the pharmacy of the world today, thanks to the painstaking efforts of several pharmaceutical leaders over the past decades. But how do we move on from here and become the research lab of the world also? I mean, with the scientific talent and bandwidth that we have in the country, why should we not aspire to be the research lab of the world? And this first session will actually try to address some of these aspects, and you'll hear from very senior industry leaders and policymakers. The second session will look at the ever-evolving scientific advances. We are talking a lot about cell and gene therapy, CAR-T, you name it, and there are newer things. And how do we really practically look at it is what we will see happening in session 2. And while a lot is happening on these areas, back home in India, we still have some very basic problems to address, which we cannot move past. So while on one hand, world is moving towards gene therapy and personalized medicine, from a country point of view, we have to also think of how some of the neglected diseases and tropical diseases get addressed. And that's where, again, we have a very power-packed session 3. And finally, the 4th session will bring all of these elements together and deliberate as to how collaboration and co-creation can accelerate our journey into the global innovation and research and development arena. So that's the plan for the day, and we have a lot to cover, but I want to sincerely thank my colleagues and friends in the steering committee who, as Dr. Mattoo said, they have not just given their blood and sweat, but very, very, pragmatic ideas, which is making these deliberations possible today. So thank you so much to each one of you.